Hi, this is Jack Daulton again. It's May 11th, 2011, and this is the 5th day of my hospital stay following my second brain surgery. I'm with my daughter Melanie, and she's just starting her senior year at Dartmouth, and she flew out from Dartmouth in Hanover, New Hampshire to visit me yesterday, and we spent the day together. And I just thought I'd like to inform you about the status of my condition following my second brain surgery, where we are now, and where they expect my condition to develop in the future. As most of you know, my second brain surgery was undertaken as a result of the diagnosis of an infection in my brain. A bacterial infection. It manifested itself on Saturday, 5 days ago, when I felt a slight swelling along the rear incision line of my previous surgery and some tenderness. My fiancee, Roz Ho, noticed that the area was a bit red. We went to the emergency room. I actually, Melanie, expected them to apply some ointment to the area, and that would be about it. In fact, I mean, I had no idea it would be something more dramatic than that. Some inflammation, on the surface. In fact, they very quickly determined that it was just the outer or external manifestation of an infection that emanated from the inside of my cranium, the inside of my skull, an infection of the brain, actually, and of the skull itself. And an emergency surgery was conducted, a brain surgery was conducted, as I explained in my last video, requiring permanent removal of a 2 by 2 inch section of my skull, a cleaning out of the infected area, and irrigation of that area with antibiotic. And I've been in the hospital ever since, 5 days, a relatively long hospital stay, longer than my initial brain surgery, which I think had required a 2 or 3 day hospital stay. During that time, I've received regular infusions with broad spectrum antibiotics to combat the infection intravenously, about 3 times a day. And they've been conducting an ongoing investigation to determine what kind of bacteria I'm infected with. And they do that by taking samples of the bacteria which they collected during the surgery and trying to grow them, I guess in a petri dish, a culture, as I think they call it, right? Mm-hmm. Unfortunately, they've not been successful in determining specifically the kind of bacteria it is. The hope was that they would be able to make that identification specific, because then they can really tailor or fine-tune the type of antibiotic I receive. Because they haven't been able to do that, they're going to keep me on a broad spectrum antibiotic, vancomycin they call it, and we'll go forward with that. And a broad spectrum antibiotic covers a wide range of bacteria, and which will include whatever undetermined bacteria I'm infected with, presumably. So that is the status of the investigation of the type of infection I have. As I said in my last video, they've inserted what's called a PICC line in my left arm, the inside of my left upper arm, which allows them to administer. You can pull that up, yeah. Which allows them to administer very efficiently the intravenous antibiotic. And essentially a PICC line is a catheter that extends from a major vein in my upper arm up through my shoulder area or my chest area, and then behind my heart, eventually reaching one of the major veins in your body, the vena cava, which through which blood flows with great velocity. The antibiotic is injected into that area through this catheter and then distributed through the body up into the brain specifically very rapidly and without much, if any, irritation of the vein itself. So an additional issue, beyond the issue of the type of bacteria causing the infection, and the treatment of that bacterial infection. An additional issue that has emerged is that my right arm, has become increasingly compromised in terms of its motor ability. It's very weak, and I don't have much control over it. I mean, here's my left hand and arm, which you can see is quite vigorous, and there's relatively good dexterity there. And here, by contrast, is my right hand, which is rather pathetic, right? I don't have much control over it. Immediately after the surgery, my dexterity and functional ability in my right arm was nearly 100%, but over the next 24 to 36 hours, it deteriorated rapidly, and to what I think is like maybe 20% functionality. So it's not very useful at this point in time. A positive development today around midday, it was better. It was, marginally, but materially better, and we're hopeful that that's a sign that it's going to continue to improve over the next few days. If it doesn't, they will have to start yet another course of steroids, which is something I'd like to avoid because that's such a serious drug. As you know, Melanie, one of the standard motor ability tests or neurological tests for motor disability is to hold your hands in front of your body, palm up, and see if you can maintain that position with your eyes closed. So many people have done this with me. Would you like to try that?
Sure.
Okay.
So what do I do?
You put your hands in front of your body.
Oh, I do it. Okay.
Palm up, and look at this. I've got such drift in this arm. I can hardly even get the palm of this hand up. But close your eyes and then try to maintain that position. Let's see how we both do. I'm actually struggling to just get the palm turned up, and I'm not able to do it.
How long do I have to have my eyes closed?
That's probably good enough. And you can see that.
All right.
You can see that look at where my hand ends up.
Yeah.
I mean, I can't maintain the position.
You can't do
But do you
this
think
right
that's?
now?
Yeah,
Do you think that's like strength of being able to hold it up, or do you think it's like
No, it's
a disawareness?
Well, first of
space?
all, I've got to pronounce what they call pronator drift, which is I can't even force it into the upper position. The drift is so severe, and that's a classic evidence of a neurological deficit. What was your question though specifically?
Because I know you have a loss of strength as well as a loss of perception of where your hand is in space.
Yeah.
So do you think this is related to a loss of strength or a loss of perception of space?
Well, I think pronator drift is something a little different than proprioception, which is an inability to perceive parts of your body in space. I think I have that as well as this pronator drift. But there's also generalized great weakness in this arm, lack of manual dexterity, and so there's a lot of different motor things going on here. So obviously, some serious inflammation is affecting my motor cortex, and they became concerned about this in relation to the infection. They were concerned that some pocket of infection had gone undetected or had developed. So they sent me down yesterday for another MRI of my head. The fear was that in fact they would find a pocket of infection. I presume that would have required them to go back into my skull to try to clean that out. Fortunately, this morning the result of that MRI came in and they didn't see any evidence of another area of infection. There was inflammation in the area of my motor cortex, and that's probably what is causing this problem. Now, this is the end of the 5th day. I'm tired now. Earlier in the day, you were there with me. You could see that my hand was much better after having been much worse. And so we're hopeful that after a good night's sleep, tomorrow morning it'll be better than it is now, and this incremental improvement will just continue over the following days and weeks. If it doesn't continue to improve, if it gets worse, then they will seriously consider putting me back on a regimen of steroid to reduce whatever inflammation is causing this motor deficit. You know, I used to be freaked out by these motor deficits, but over the last 2 months I've experienced them so many times. I mean, at the lowest point I couldn't even move the fingers of my right hand. I mean, it was near complete paralysis. So it no longer really freaks me out that much. The fear is that at some point there will be some permanent loss of motor ability. Hopefully there won't be. Now the overriding issue, though, is this infection. While the motor deficit is a concern, especially if it's secondary to the infection, it's of less concern than controlling the infection. And we presume that with a regimen of broad-spectrum antibiotic, that infection will be controlled. Unfortunately, as I think I've told you, it takes a long time to be sure you've eradicated a bacterial infection. So the course of treatment with antibiotics will probably run 2 months, if not more. And then it'll be a considerable period of time thereafter before they replace the section of my skull, because they don't want to replace it until they're sure the infection has been completely eradicated. One other positive development, as you know, is that I'm going home tomorrow. After 5 days in the hospital, tomorrow morning I'll go home, and that is really a welcome development. I mean, they've treated me so well at the hospital, but I'm sick of being in the hospital bed, and I long to be back in the familiar confines of my own home. And tomorrow morning that will happen. I've received this PICC line so that at home the intravenous antibiotic can continue to be administered. I think it'll be administered twice a day. Because I lack the manual dexterity to do it myself at this time, we will hire a professional service to administer it for me at home. And that will be a major kind of lifestyle change for me, right? Having to have antibiotic administered intravenously by a professional at home twice a day for at least 2 months. Another lifestyle change for me will be the fact that I've got a 2 by 2 inch section of my skull missing on the top of my head, which makes my brain very vulnerable to trauma should I bump it. As a result of that, I will be wearing a helmet of some type. We've got a street hockey helmet over there, the red helmet, and we've also bought a climbing helmet and a biking helmet, and we're looking at other helmets as well, like a pith helmet or equestrian helmet or a batting helmet. But technically, I should be wearing a helmet at all times, because something could fall on my head. I could bump my head on some object in my environment at home. Obviously, when I'm outside, especially in a car, I absolutely have to be wearing a helmet. When I'm walking around outside, I should be wearing a helmet. Something could fall on my head. Who knows? I could stumble and hit my head, and the consequences of that could be catastrophic. I mean, it's just hard to really even think about. It's scary having a significant part of your head with the skull missing, and only a relatively thin piece of tissue separating your brain from the outside. And so that's going to require a major lifestyle change too, and that's going to go on for months. I mean, as I said, the antibiotic regimen is at least 2 months. They'll probably wait some period of time after they conclude that to make sure the infection doesn't resurface, and then they'll reinsert a prosthetic skull piece into the hole that's presently in my skull, made out of plastic or some kind of titanium mesh. And then that's a major operation, of course, yet another brain surgery, and then there'll be a period of convalescence after that. So I've got a long process ahead of me. But I'm in really good spirits, as you know. We've had a lot of fun today, believe it or not. I've had a lot of visitors, including you, and I'm not particularly depressed. There was a time a few days ago that I was extraordinarily depressed, but I'm not looking forward to the coming months. It's going to be difficult, but I know I'm going to make constant progress, and before I know it, it'll all be over with, God willing. So I think that's essentially where we stand now. I'm looking forward to the discharge procedure tomorrow. I'm glad you're going to be there to witness it and help me with it. And tomorrow morning by noon, I'll be home. Before we conclude this video, do you have any comments on what you've witnessed today during the last 24 hours that you've been with me?
No, I'm very impressed by how good your spirits are. You seem to be in a very good mood, and you seem to be doing very well. Much better than I would have expected.
Yeah,
for someone with a brain infection. Yeah,
it sounds absolutely dreadful, and it is absolutely dreadful. But it did affect me profoundly, psychologically. I have to say that when they first told me about my condition, the diagnosis, and what would have to be done, I was just in a state of shock. And on some level, I still am in a state of shock, actually. But I don't know. I think I kind of compartmentalized it. I don't go to the dark area. I don't think about how dreadful it really is. But I just kind of take one day at a time and one moment at a time, and I'm still having some fun. And a lot of jokes, and proceeding in as positive a state as I can, and that's what works for me anyway. And it's when I lose that ability that things really start to go south, and hopefully the medical condition will just continue to improve, and that's my expectation. That's the expectation of my doctors. So it's all good. It'll all work out in the long run. So
yes.
Anyway, thank you for coming out to visit me. I know you made a special effort to fly out here all the way across the country to see me, and it meant so much to me. So thank you very much.
I'm very happy to be here.
Anyway, that's the end of this second chapter in my second brain surgery video series. Thank you very much.